Hey everyone! Today, we're going to break down a topic that can feel really complex and, honestly, a little scary: breast cancer. Our goal here is to walk through it, step by step, so we can turn any confusion into real, solid understanding.
So here's our game plan. First, we'll get into what breast cancer actually is on a cellular level. Then, we'll cover the risks and warning signs to be aware of. After that, we'll map out the path to diagnosis, look at the different treatment options, and finally, we'll talk about the really important road to recovery.
All right, let's jump right in. To really get a handle on this, we have to start small, like really small. We're talking about what's happening inside our own bodies, at the level of ourselves. What exactly is going wrong?
Okay, so here's the absolute key difference. Our normal, healthy cells, they follow the rules. They have a built-in instruction manual that tells them when to grow and when to, well, die off. It's a process called apoptosis. But cancer cells, they just tear up that rulebook. They mutate, they grow like crazy, and they completely ignore the signals to die, which is how they end up forming a tumor. Now, this is really interesting. When a lump is found, one of the first things a doctor checks is, can it move? You see, if a lump can be wiggled around under the skin, it's often a good sign. But if it feels fixed, like it's stuck in one place, that's more concerning because it could mean it's attached itself to nearby tissues, which is a classic sign of cancer.
So that brings us right to our next section, knowing what to look for. Because when it comes to your health, awareness is probably your most powerful tool. Let's break down the key risk factors and red flags.
First up are the things that, well, you just can't change. These are pretty much hardwired by our biology and genetics. Being female and getting older, especially over 50, are the biggest ones. Of course, having a personal or close family history is also a major factor, along with specific inherited genes you might have heard of, like BRCA1 and BRCA2. Even your body's hormonal timeline plays a part.
Now, on the flip side, there are risk factors that are more tied to our lifestyle. Some of these are complex personal decisions, but others, like maintaining a healthy weight, staying active, limiting alcohol, and of course, not smoking, those are all areas where our choices can really make a difference. And this is so important, because it's not always about finding a lump. You need to be aware of other physical changes, things like any nipple discharge, or if the nipple suddenly pulls inward, any unusual pain, or changes in skin texture, like thickening or dimpling. And that orange peel look you see here, that's a classic sign that needs to be checked out right away.
Okay, so let's say you've noticed something, or it's just time for a routine checkup. What happens next? That brings us to section 3. We're going to walk through the exact path doctors take to go from a potential concern all the way to a certain diagnosis.
It's really helpful to know that there are two main types of tests, and they have totally different jobs. Screening tests, like a mammogram or a self-exam, are like casting a wide net. They're for finding potential problems early, even before there are any symptoms. If a screening test flags something, then you move on to diagnostic tests, like an ultrasound or MRI, which are like using a microscope to get a much closer look.
And this pathway here really shows you how it all unfolds, one step at a time. It usually starts with that first screening. If there's a concern, you move to more detailed imaging. Then comes the most crucial step, the biopsy. That's where they take a tiny tissue sample, and it's the only way to get a definitive yes or no. If it is cancer, the final step is staging, which tells doctors if it is spread. So once a diagnosis is confirmed, the whole focus shifts. It becomes about the fight. And that brings us to section 4. Let's take a look at the incredible ways modern medicine takes on this disease. The great news is that today there is a whole arsenal of treatments, and they're often used together. It's a team effort, and every plan is personalized. The main pillars of the fight are surgery to actually remove the tumor, chemotherapy, which uses powerful drugs to kill cancer cells anywhere in the body, radiation, which targets specific areas with high-energy rays, and hormonal therapy for cancers that are fueled by hormones. Now, while these treatments are fighting the cancer, they can have serious side effects. One of the biggest ones to know about is a condition called neutropenia. You see, chemotherapy can also knock out your healthy white blood cells, specifically your neutrophils. And these guys are your body's frontline infection-fighting soldiers. Without them, your immune system is seriously weakened. So, because that immune system is basically offline, keeping the patient safe from germs becomes priority number 1. This means taking some serious precautions. We're talking about wearing masks, avoiding anyone who's sick, and even staying away from things you wouldn't think twice about, like fresh flowers or raw veggies, which can carry germs. It's all about creating a protective bubble.
The battle isn't over just because the last treatment session is done. In many ways, that's when a new chapter begins. Section 5 is all about that journey, the road back to wellness through recovery and post-op care. Okay, this part is absolutely critical, especially after surgery. The arm on the side of the surgery is at risk for a swelling condition, so there are some hard and fast rules. Think of that arm as a no-go zone. No blood pressure cuffs, no IVs, no shots. It's also so important to avoid heavy lifting for a while and to steer clear of tight clothes or jewelry on that side. And we have to remember, healing is not just about the body. The emotional and psychological part of this journey is huge. It's about feeling whole again. And there are amazing options available to support that, from prostheses and surgical reconstruction to incredible artistry like nipple tattooing. All of these are powerful tools for healing. Last but not least, let's talk about food. Your body needs fuel to rebuild and recover, but treatment can totally mess with your appetite. So the game plan is usually to focus on small, frequent meals that are packed with protein and calories. Think things like eggs, tofu, and of course, lots of fruits and vegetables to give your body the building blocks it needs.
So there you have it. We've gone from a single cell all the way through to recovery. It's a lot, I know, but understanding the process is everything. It takes away some of the fear and gives us power. So I'll leave you with this question. What's one proactive step, big or small, that you can take for your own health, starting today?